Hi, everyone. I just turned on the webinar so everyone can get logged in and settled in. We'll get started here in about 60 seconds. All right, looks like everything is working properly. We've got over 20 people logged in, so the system seems to be going well. So let's go on and get started. My name is Lincoln Anderson. I'm the financial advisor here at Oklahoma Central Credit Union. I run the financial planning department, cover all 10 branches here, and I'm going to be your host today. Happy to have everyone along for our third webinar of the year. Just a couple of housekeeping things before I turn things over to our speaker today. First of all, we aren't allowed to use chat in these, but we do have a questions feature. So if you look at your menu on the right, should be just above handouts, there's a section called questions. So if you have any questions during the presentation, put them there, and time allowing, we will try and address some of those at the end of the meeting. So we do have a questions function, but no chat. Now, secondly, to address the biggest question that we always get, we will have a replay, and it will be available to all of you who registered. You will have access to it probably sometime tomorrow, usually in the morning, sometime in the afternoon, but we will get everyone an email link to a replay. So you don't have to worry about that. If you have to step away or you miss a little bit, the replay will be available. So for now, let's just go on and jump into our presentation for today. We have another great guest speaker lined up. His name is Dave Vogel. He is a senior advanced market consultant with Allianz. He's been there for more than 10 years. He's a chartered life underwriter, a certified financial planner, and I think he has even more letters than that he can put after his name when he chooses to. He spent a lot of time getting knowledge and wisdom, and he's here today to share that with us. So I'm going to go on and turn the controls over to Dave and let him share with us.
All right, Lincoln, thank you.
You bet.
You seeing everything all right here?
I am seeing it. I think you're good to go.
All right. All right, well, thanks everyone for joining us today. Important topic, lots of questions on this here at Allianz. It's healthcare, Social Security, Medicare, they kind of get rolled in together. But we're going to talk today almost exclusively about Medicare and some of the options there. So there are my 3 designations. I don't have any others. We just missed, what was it, the Chartered Financial Consultant. But I'm the Senior Advanced Markets Consultant at Allianz. We take questions from around across the country, from different advisors on things like Social Security, Medicare, trust, estate planning. But lots of questions on this. It's a big thing, especially with all of the boomers that have been turning 65, really starting about 10 years ago and continuing today. So healthcare is a huge cost in retirement. I mean, these numbers are just huge. By 2028, 6.2 trillion is what this, as a country, we're going to be spending on healthcare. Growth rates have been higher than inflation. So 5.4% is the expected growth rate between, well, 2019 and 2028. It has never been lower than inflation, just historically over the last, say, 20 years. I've got some more slides we can kind of illustrate this, but healthcare, as great as it's been, think of all the improvements in technology, prescription drugs. I mean, there's been a lot of great things going on in the healthcare world that are helping people live longer, but it also is expensive, right? So here's a nice, I like this screenshot. So you go back all the way to 1999, the overall rate of inflation since then, 73%. Not too bad. 103% is what the average increase in workers' earnings have been. So people are getting ahead of where inflation was. We're just going to pretend that 2022 didn't happen, and 2021 for that matter. But things are moderating there, just in the last, 6 months or so, let's just say. But over the long term, look at what happened with healthcare. The increases in healthcare costs have just been huge. So family premiums up 288%, worker contributions to their healthcare through their employer up 296%. So huge, huge numbers. I actually graduated from college in 98. So I remember my first paycheck with my healthcare deduction. It was not that much. Of course, I was single. I was 22, 23, and now I've got 3 kids and a wife, and our healthcare costs. It's a big chunk of our check now. One, because it's more people, but also just these costs. They just keep going up year after year. So it's especially important when we start talking about retirement. And for those that are 65 and older, it makes sense. Their cost for healthcare is higher than, on average, everyone else. You can see here just broken down generally some of the big ticket items, for all ages versus 65 and older. You can see healthcare is the biggest jump. And that makes sense, right? Most people generally have lower healthcare costs through their 20s and up through their 50s. Things start to crop up in their 60s. And, as we get older, we need more care. So healthcare costs, for retirees, it's a big, big deal, big subject that people want to talk about. So we're going to talk about that today, some of the options before retirement for those retirees that are under age 65, not able to get to Medicare yet, and then 65 and beyond. So before retirement, I'm not going to spend a whole lot of time on this. People are probably familiar with what they have, but just generally, there's HMOs, there's PPOs, and there's point of service. HMOs are more restrictive in where you go, but they generally have lower cost. PPOs have, a little bit more expensive, premium options, but they're not as restrictive, right? You can work with physicians outside of your network. And then you've got your point of service. They're more restrictive, and you need to get referrals to talk to specialists. So you're kind of stuck with what your employer offers, right? For the most part, for most of us. This is one of the things that Congress and me personally was hoping would have a greater impact on keeping costs down, but it was the advent of the high deductible health plans, HSAs. So the thought there when they created these, and they are working to some extent, and I actually use one of these through my own company. Allianz has a high deductible health plan. And the idea is if they give you a certain amount of money and you go shop for your care, that consumer, shopping around will help lower costs in general. And it's kind of worked. It hasn't been the perfect, arrow out of the quiver to solve all these rising healthcare costs. But the cool thing is that it generally should have lower premiums than other plans. You put money into your health savings account. Employers often will match or put a certain amount in to that health savings account as well. And those health savings accounts are portable. So if you don't use it in a given year, that balance carries over to the next year. And if you change jobs, you can move that HSA to your new HSA at a new employer. So they've been working great for many people. They have lowered premiums in some cases. And the nice thing is that you do get to put the money into your HSA. That's tax-free. It gets tax-deferred growth. And if you take the money out and use it on qualified healthcare expenses, it comes out tax-free. So we get this question a lot. When you are in advanced markets at Allianz, there's over 2,000 people here. They know that we know things. And so they come to us, usually it's around March of every year, and they say, hey, we just talked to our accountant. We're going to owe X amount of dollars. What can I do to lower my taxes? Well, once you cross over to January 1st, there's not much. But this is one of those things. If you have an HSA and you have not put in the maximum amount, it's kind of like the best thing out there for taxes. You get a deduction for putting that money in, you get tax-free growth, and you get tax-free pulling it out if it goes for education, or excuse me, healthcare expenses. So it's kind of like a Roth IRA that you get a deduction for. What does it not cover? So qualified medical expenses from your HSA, it's not going to be, you know, everything. You can use them for COBRA or ERISA coverage, certain long-term care insurance, health coverage during unemployment, and coverage over age 65, including Medicare premiums. So those can be used. At 65, you can take the money out without the 10% penalty, but it's going to be taxed as ordinary income. Okay, so you put the money in tax-free, you get tax-deferred growth, and you can pull it out tax-free for qualified healthcare expenses. But once you're 65, there's not that 10% penalty. So some people, you know, they look at their HSA, they see a few $1,000s in there, and they pull it out, and let's just say they go to the mall and buy some clothes. Those obviously aren't qualified. You'd actually pay tax on that and have a 10% penalty on that $1,000 if you took it out. But once you're over 65, you know, you can use it for other things. You won't pay the 10% penalty, but it'll be taxed. But you can use it for any of those other qualified expenses. Here's some of the limits on the HSA. So if you're an individual, you can actually put up to $3,850 in per year. If you have a family plan, which I do, I can actually put up to $7,750 into my HSA. I'm not yet 55, but once I hit that age, I can put an additional $1,000 in there. And then here's the kicker. These are the deductibles, the minimum. So we're paying out of pocket, and we can use that HSA on the first $3,000. And the maximum is $15,000 per family. So I'm somewhere actually in the middle here. It's not quite that high, thankfully. But that deductible, again, is your responsibility. And then once you hit that deductible, your actual plan will start taking care of those costs, okay? So you got to spend it out of your own pocket. You use the HSA to pay for that. In theory, you should have enough in there. Not always, but that's one of those reasons why it's always, if you're looking for places to save additional money, your HSA is one of the best places out there to do it. And then once you go over that deductible, then care is covered for, okay? So COBRA's out there for those, you know, under 65. If you lose your job, you can get coverage through your former employer's coverage. It can get you up to 18 to 36 months. You are going to have to pay full cost. So not only what you were paying before, but if you're not working there anymore, your employer is not going to be picking up their share of the cost. So these can get kind of expensive. One of the downsides to COBRA is that generally you can't move from state to state. So I lose my job here in Minnesota and I decide to go on COBRA, but for whatever reason, let's say I want to move to Florida, my COBRA coverage from Minnesota is not going to carry over down to Florida. I'd have to look elsewhere at that point. So we've got the Patient Protection and Affordable Care Act, also known as Obamacare. This came about in 2010, and it had a whole bunch of changes come through. Most of them were good, some of them not so good. But what generally it did is it said you cannot have insurance coverage that qualifies as insurance unless it covers these things. Okay, so one of the bad things is there was, you know, if you want to call it truly pure insurance, like where it would cover only the big things, like if you got cancer, if you were in a car accident, right? And it wouldn't cover much of anything else, but those premiums were very, very low. Well, what the PPACA did was said, okay, you have to cover all these things. And I'm not going to read all of them off here, but what did that do? It got rid of those really cheap plans that some people liked and wanted to protect themselves from the catastrophic things. So now all of these things need to be covered to qualify as insurance. And it did, at the time it passed, it mandated that you had to have coverage for you, your kids, dependents. And if you didn't have that coverage, there was actually a penalty for it. And that penalty actually went away. That got tossed out with the Tax Cuts and Jobs Act. So you're still mandated to have coverage. But if you don't, you're not actually penalized for it. So it's kind of that weird situation that we're in. But the thought is that if everyone's getting insurance and everyone has to have insurance and all these things are required, that it would help bring costs down. Okay, your mileage may vary with your experience on that. I'm not going to get into everyone's unique situation. For some people it helped and some people it didn't so much, but it also had subsidies for those premiums. Okay, so the less you made, you might have some of those premiums picked up through the government. So most of you, if you've gone through this before, because you're doing insurance on your own outside of your employer, you're probably familiar with this. You go to healthcare.gov. Some states built their own website. I'm not sure about Oklahoma, but so what can they price off of? So depending on where you live, that can change your premiums, the type of plan you selected, of course, your age, your family situation, whether you smoke or not. But one of the big things that was a big win for most people was that they could no longer exclude you for pre-existing conditions. So some of those plans, if you had, say, if you were diabetic or if you had some other chronic illness and you went out to buy health insurance, they would underwrite you and they'd either decline you or charge you a heck of a lot more in premiums. So that went out with the Affordable Care Act. So that's one of those good things. But again, it did generally cause many insurers to raise their costs. You know, if you can't underwrite and you got to insure everyone, that's going to be reflected in the price. So some of the important enrollment dates, starts November 1st. You're probably going to start seeing some commercials on the television now as we get closer into September here and October, just reminding people, hey, you have a chance now to re-enroll November 1st. Cutoff is December 15th. And then the coverage pretty much goes for the entire year from January 1st to December 15th of the same year. So it's important to do that. Once you pick a plan, you're generally going to be stuck with it for that year unless one of these events occurs. If you have coverage through your work and then you lose it, you could go in past that enrollment period and go on, you know, to one of the federal plans. If you move to a new state, you have a huge change in income, you get married, divorced, you have a child, you adopt someone. These are some of the things that could actually allow you to go in past that December 15th deadline and go into the Affordable Care Act coverage. All right, so FSAs are cool as well. They're kind of like an HSA with a little bit of a twist. And what's nice about them is you can put in up to $3,000, $3,050 for 2023. It's great for things that you know you're going to spend on healthcare, but that it's not covered from your healthcare plan. So a lot of people, this might be vision or some of that dental work. You know, it's kind of funny. I have 3 kids. Most of them have lost most of their teeth, but things like braces, which we had to do for one, that's not covered through our dental plan at work. And so when we knew the cost for those braces, it was more than $3,000, but we put that money into the FSA, we got a deduction, and it came out tax-free to help pay for the cost of those braces. LASIK's another popular one. You know, things like that that aren't covered by your healthcare plan, but you know you're going to spend in the coming year. The big difference with FSAs is that you can't keep rolling everything over. In 2013, they limited it to, they actually allowed you to roll some of it over. It's up to 610, but it can't be rolled over if your FSA has a 2.5 month grace period. So check, if you have an FSA, check with it. Some of them, it's got to be spent by December 31st. Some of them allow you actually to go into, you know, February. If your plan does allow you to go into February, you can't carry over that 610 to the next year. So FSAs are cool, especially if you know those expenses are coming. All right, so we touched on this a little bit, but here's the numbers for what are your annual premiums on average across the country here. If you're single, you're going to be spending about $1,300 on average. You've got a family plan, about $6,100. These are annual amounts. But behind the scenes, or maybe not behind the scenes, our employer likes to tell us how much they're covering. It's actually, in my case, more than this average here, just by a little bit. But the employer is usually picking up a good chunk of that. If you're in a corporation salary level, they tend to be quite generous with this. Can be quite generous, not always, but it's a big, big cost. So what can you do for those that are under 65? Look at your different options. I actually did go on to that healthcare.gov way back when to see if it made sense to switch to one of those plans versus what I had through my employer. Wasn't even close. The employer had it much better coverage. We made too much money essentially to get any subsidies through the Affordable Care Act, so we stuck with it. But if you're, everyone's unique in their situation, it doesn't, hurt to go look at it and just see where you're at, especially for those that are retiring early. 60 might be the age that people start looking at retiring, not everyone, but if you lose your employer coverage because you retire and then you can't get Medicare until 65, now's your chance to start exploring, right? And go to healthcare.gov. All right. So what other options are there? Allianz is a huge company. It does pretty well. We don't have retiree health benefits here. I'd be hard pressed to name one that does. There's apparently 27% of companies do offer some form of retiree health benefits before they go on to Medicare. I've never worked at a job there. If you're lucky enough, hopefully some of you on the call do have that option. I wish I did. It'd be great. But I'm a couple years older than my wife, and I've actually told her, hey, I'm punching out at 60. She'll be 58. I'm like, I need you to keep working a couple more years so that we can be on your health care through your work. And she's we'll see how that goes. We might just have to retire together and go on to healthcare.gov. But the other option is COBRA. You can do that up to 18 months. Again, I would have to pay the full out-of-pocket cost for not only what I've been paying now, but what my employer has been covering as well. This is great. And Lincoln said we've got a replay of this. I'll send out a PDF of the slides here, or if you have the time here, I'll stay on this slide for just a minute here. If you want to just jot this down here. This is a great website. It helps you estimate those costs. You can go punch in the state, your income, and what coverage you have, how many people are in the family, how much does it, how many people do you have to cover, and it'll come up with an estimated annual premium for you. Okay, so if you're thinking about it and you don't want to go through all of the officialness of the healthcare.gov website, this is kind of a cool site. I've went out there since just to kind of check in to see if it might be cheaper to leave my work plan. It isn't, but it's a nice quick way to do some calculating. So Medicare. All right, so for those turning 65, that is when you can officially go on Medicare. You do have to enroll if you're not yet claiming Social Security, okay? So for most people, through most of their life, once you start taking your Social Security benefit, they're gonna deduct your Medicare costs right out of your Social Security check, okay? But for some people that do retire early, or even if you retire at 62 when you can first claim Social Security, but you're waiting to take your Social Security benefit at full retirement age, 66 or 67 for most, or 70 to get those delayed retirement credits, you've got to set up with Medicare how you're going to pay for that until you turn on your Social Security benefit. And when you enroll can affect your Medicare Part B premiums. So we're going to get into that on the next couple of slides here, but just be aware that when you go on Medicare, they look back 2 years at your income to determine your premium, okay? So when you're looking at retirement, if you're looking at doing things like Roth conversions has been a hot topic ever since the Tax Cuts and Jobs Act passed. We're kind of at the lowest tax brackets many of us are ever going to see going forward. If nothing else changes with Congress and the president passing new legislation, in 2026 taxes go up. So there are a ton of people looking at Roth conversions, but my point is that they look at your income tax return from 2 years back to determine what your Medicare premiums are going to be today. So right now, if you were filing for Medicare, they'd be looking at your 2021 return. So what do we got in Medicare? So Part A, that is the free part. There's no premium associated with Part A. That's going to cover hospitalization, hospice care, and some home health services. There are copays and deductibles. We're going to get into, nursing home care, long-term care costs. That Part A does not cover that, okay? But it will cover some of these things up here. Part B is what the majority of people think of when they think of Medicare. That's going to cover physician services, outpatient hospital services, long-term care, long-term nursing home care is not currently covered by Part B or A. Part B is going to have a premium. We got a couple slides on what that premium is currently. If you want coverage beyond what Part B has, you can go to Part C, and that's your Medicare Advantage plan, okay? And so those are going to be ones that you are going to be shopping for. They vary from state to state. Even certain states have different plans within them that you can kind of pick and choose between depending on your unique situation. And then lastly, Part D, that's your prescription drug coverage. And again, that it's voluntary and it's relatively cheap, but that was a big one passed back in the, I'm just going to say early 2000s. That was under George Bush. I forget the year on that, but that was a big deal to have prescription drugs covered through Medicare. Previously to that, they were not. So here's the numbers. Whoops, there we go. So this is the base level premium, $164.90. If you made under $194,000 in 2021, that is going to be your Medicare premium. Okay. And then it starts going up from there. Now this is per person per month, okay? And so, the more you make, the more you're gonna pay for Medicare Part B, all right? There is a thing called the hold harmless rule. Those that have been on Social Security and Medicare for, let's just say the last 5 or 6 years, you're probably familiar with this. We've had some really low COLAs in the last, the late 2020 or the 2010s. We had some 0% COLA increases, or not increases to Social Security, but your Medicare premiums actually went up. The hold harmless rule is set up so that if you have a 0 or low COLA on your Social Security benefit and your Medicare premiums go up, remember how I said they'd just take your Medicare premium out of your Social Security check? The hold harmless provision just says that your total check will not go down. So basically, if the COLA doesn't cover the increase in your Medicare premium, you won't see a net decrease in your Social Security check. Now, last year, we actually had some of the best news for retirees in a long time. We actually had an 8.7% increase in the cost of living adjustment, highest in over 40 years. I know that 8.7 might not have covered everyone's inflation that they experienced the last couple of years, but it was still a nice number. But the other thing that happened was Medicare premiums actually went down just a little bit, about 1 to 2%. So most people saw a nice increase in their Social Security check, and the hold harmless did not apply. But going forward, just know if we do have a lower COLA with a higher Medicare increase, we could see that hold harmless come into play. So these are the same phase outs, not phase outs, but the same thresholds as the Part B premiums, but these are for your prescription drugs. And so you can see here, relatively cheap to add it, $12.20 in addition to the plan premium. Now, again, Part D, it is, again, state by state. Check with your healthcare provider on what type of plan might make the most sense for you, but relatively affordable. So those are the decisions you have to make. Okay, so most people, you know, you have your original Medicare, you got your Part A and B, and then the first decision is, do you want a coverage above and beyond that? Do you want to add a Medicare Advantage plan to add to A and B? Okay. Generally, I can't talk specifics. Everyone's situation is unique, but if you're relatively healthy, you might want to be on the left side. If you've got more prescription drugs and a family health history, you might want to go and pay extra every month to have that coverage for some of those other things that might not get covered. You know, if you don't have any prescription drugs, you might be tempted to stay out of Part D. You've got a list of them, or you and your spouse combined do, you might want to start looking at Part D. And then if you don't do the Medicare Advantage plan and Part D, and you want to stay on traditional Medicare A and B, you can also add a Medigap policy. So what is Medigap going to do? It's going to basically cover things like deductibles, co-pays, and pick up costs for anything that A and B doesn't cover. Okay, so a lot of big decisions in here. I always recommend, there are people out there that this is their job. They are experts, especially in the area you live. They will look at your family history. They'll ask for a list of drugs that you're taking, and they're a great resource for you, you know, to look into, you know, should I do this plan or that plan? They're out there. I would encourage you to find them if this stuff is daunting to you. I guess you could say lucky. I'm the financial guy in our household. My wife is an occupational therapist. She does nothing but deal with healthcare providers and billing for occupational therapy stuff. So I've punted all of this stuff to her, and I'm counting on her doing all this work for me when we get to that point in our life. But there are people out there that know this stuff, you know, inside and out. I would encourage you to look to one of them to get into specifics. And again, this is the Medigap policy. It's going to cover those things that Medicare does not. And the premiums do vary from state to state. Okay. So what are some of the Medigap policies? I don't want to spend too much time on these. There's some that are called community rated. Community rated basically means it doesn't look at your age. The premiums are going to be the same for everyone, and they tend to be a little bit higher. Okay. There's other Medigap policies that are issue age related. So those are going to be cheaper if you go on one of those at a younger age. If you start one at an older age, it's going to be more expensive. But once you've done that, you're kind of locked in. So if you started in this example at 65, your premium is going to stay at that 145. Okay, so a little bit cheaper. We go back here to community rated, to issue age rated. And then we also have attained age rated. Okay, and this is where they look at how old you are when you buy it. And so in this case, we could have actually the lowest premium of the three, but then each year this premium goes up. Okay, it doesn't hold that premium for you. It just goes up every year after year as you get older. So you might save the most money early, but it could end up costing you in the long run. Okay, and we just give an example here, you know, attained age rated. Long-term care, this is a big one. There's a lot of stuff going on in the country discussing this right now. It's a huge, huge cost out there. The chances of someone needing long-term care coverage are actually quite high. You can see there's 70% chance that someone's gonna, you know, need long-term care, and the costs are through the roof. This is just your average across the country, 115,000 per year. Minnesota, I believe we're a little bit higher than that. If you go out to the east or west coast, it can be much higher than that. I've seen 200,000 just because the cost of living on the coast is so much higher. But it's something you might want to discuss, you know, with an advisor, discuss with your spouse. Like if you have the ability to look at long-term care policies, they can make a huge difference. I'm just speaking from experience. My parents actually bought long-term care policies a number of years ago. My dad had Parkinson's, and if it hadn't been for the long-term care that he bought, that would have been just a huge debilitating cost for them. And what it actually allowed my mom to stay at home with him and have someone come in and help him with all of those things that he needed help with. And it covered a large chunk of the costs. The problem with long-term care is it is expensive. People are worried about the use it or lose it feature of it, you know, because it is expensive. But there is some movement now. Some of you may have seen Washington, the state of Washington, actually put a cost out of your payroll of it's like 0.58%. So if you have W-2 income and you did not own a long-term care policy, you actually had an additional, I'm just going to say 0.5% payroll tax to cover long-term care costs for people in that state. There's talk that Minnesota might be going that route. I don't know if there's been any discussion in your state or not, but it's a huge cost for the states and the federal government, and they're trying to find ways to cover it because too many people don't buy the insurance, and then they end up needing that care, and it's a sticky situation. But the big thing is Medicare does not cover nursing home costs. So Medicare doesn't cover it. Medicaid eventually will. But to qualify for Medicaid, you pretty much got to spend down a majority of your assets. I'm going to speak very generally here now. They do vary from state to state, but generally speaking, they'll let the spouse keep a house, a car, and a few $1,000s. Okay, everything else needs to be spent down. We're talking IRAs, any other assets that you might have to be spent down other than the, a house, a car, a few $1,000s before Medicaid will start picking up the costs. Okay, so that's where long-term care can come into play. You can use that money to keep a spouse, in a local bed, if you will, someplace close where you can go visit them. If Medicaid starts picking up the tab, you go where there's an available bed, and it might not be the one in your same city or even county. It might be across the state. So having that flexibility by purchasing long-term care insurance may make sense. So what are the premiums? If you add it all up, it can get expensive, right? So here's your Part B premium, $164.90. On average, Part D is going to cost you about $43. If you want to get a Medicare Advantage supplemental plan, that on average is another $178. So $385 per month, $4,630 a year. Married couple, that's $9,000 just over, and that again isn't going to cover your deductible, your copay, dental, vision, hearing coverage. This is one of those reasons I'm trying to use my HSA as best I can. I even try and not use it to spend on the little things. Like I tell my wife, hey, if the kids have a $50 bill for whatever, leave it in the HSA, let it keep growing tax deferred. We can keep it in there for another 20, 30, 40 years with tax-free growth, and let's just pay that $50 cost, put it on the credit card, we'll pay it off at the end of the month. So saving for healthcare is hard. There's just a huge amount of cost there. This is just your average 65-year-old couple retiring last year. This is the anticipated total cost of healthcare throughout retirement. That's just a huge, huge number. And so this is where having those savings discussions with your spouse, with your financial advisor, it's like, how are we going to cover these costs? Okay, it's never too early to start saving. I don't know the audience in its entirety here, but if you have the ability to save, this is one of those things that, how are you going to address this? There's different ways to do that, especially with the inflation that healthcare has. There are some products out there that actually will give you guaranteed income for life with the ability to increase your income. Through an annuity. Some of those discussions probably should be had and at least take a look at it, because this is, I'm from Allianz, we sell annuities here. This is just like the 30-second commercial. If you have some of that money in the annuity, it will never run out. It'll keep making that payment as long as you're alive. And some of our products have the ability to have increasing income to help keep pace with inflation. And these are good things here. Life expectancy has been going up. I mean, I was actually kind of surprised to see some of these numbers. We did have a little blip in 2020, 2021 because of COVID. You know, average life expectancy did dip a little bit. I expect that trend to reverse here as we go forward, just because of all the improvements in healthcare. But look at the chances of at least one of the couples living to a certain age. So if you got a 65-year-old couple, there's a 90% chance one of them is going to make it to 85. 72%, one of them is going to make it to 90. And we're just under 50-50 that one of them makes it to 95. Okay, so if you're retiring at 60 or 65, there's a good chance you're going to need a retirement portfolio that can get you 30 to 35 years. About a year or two ago when I gave this presentation, this number was 49%. So you can see where that dip in life expectancy came. But you're still pretty close to 50-50 that one of the two is going to still be around and needing that retirement portfolio, to keep generating income for them. So just looking back here, we talked about this in one of those first slides, but Social Security COLAs have averaged 2.5% over the last 30 years. Medicare Part B has been averaging a 5% increase. Last year was one of the few times that flipped where we had 8.7, and this was actually a slight negative number. I think the trend is probably going to revert long term as the Fed gets inflation under control here and healthcare costs keep going up. I think we're going to see numbers like that, going forward. And so I'm about to wrap up here. A little bit of time for questions, but what can you do? I think if you're not working with, if you're in those Medicare years, I think I would definitely want to reach out to someone that does that for a living, selling those Medicare plans. They're going to know what's going on in your state and county. They're going to look at your unique situation. They can help save you money on those premiums. Talk about, potential for increasing income. If you've got a 401k or an IRA, 2022 was a nasty year for the stock and bond market. Maybe it makes sense to have at least part of your portfolio in something that can last for your entire lifetime and your spouse's lifetime, and can help give you some of that stability in your income. At least look at long-term care. It is not cheap, but it can make a huge difference to keep that loved one getting the care they need without having to spend down the healthy spouse's assets and basically leave them with not much left over. My dad had Parkinson's. It doesn't kill you the next day. It's like he had several years of quite high costs, and had they not had that coverage, my dad's IRA, my mom's IRA would have been severely impacted. As it stands, my mom actually has a fair amount of money. She's still in her 80s, and I'm not too worried about her right now because we know we have enough money there to keep her doing what she wants to do. So there we go. Lincoln, did you have any questions come in, or did you have anything you wanted to ask me? I'd be happy to chat about them, or I can flip back to some of the previous slides here if people have questions on it.
No, actually, at this point, we don't have any questions. So I guess it's just clear as crystal the way you explained it. So thanks so much for doing that, Dave. I think we had some great information shared today. I did notice that we had someone show up about 10 minutes ago, and I just want to let you know that there is going to be a replay. You missed a lot of good information, but that is going to be available to you. We will have emails go out tomorrow with replays. In the meantime, I still don't see any questions, so I guess we'll go on and wrap up. Dave, thank you so much for being on with us and sharing this great information. We really appreciate it. If anyone has any questions or follow-up that didn't come to you during the meeting, but it comes up later, you can always reach me here at the credit union, and I can be happy to find information if I don't know the answers myself. My direct line is 918-280-5211. Again, that's 918-280-5211. And my name is Lincoln Anderson. not Jana Harding, like you're seeing at the bottom of the screen, but Lincoln Anderson, and I am the financial advisor for all 10 branches here. So thank you to everyone for attending. Thank you again to Dave for presenting, and we will see you on the next webinar and hope you have a great week. Thanks. Bye-bye.